Hello, everyone. We are going to have a discussion on introduction to public health. And in this session, we will be able to define public health, be able to describe the history of public health, and also be able to state the functions of public health, the futures of public health, and the different levels of disease prevention. And then lastly, we shall look at the concept of the new public health. Public health is a discipline that is actually concerned with ensuring that populations are protected and that health is also promoted through activities that um, involve the community in general. So, in protecting the population from health problems, we work with entities or organizations and also government agencies. So the total of or the network of all these institutions working together to ensure that the health of the population is protected is what we call public health system. So the public health system is just the network of all those institutions that are working together to ensure that the population is protected. Public health officials or professionals are engaged in a number of activities, and they include disease surveillance. This is basically collecting data about the different diseases that are happening within a given population. And therefore, we use this data to be able to predict what will likely to happen, to be able to plan, and also to be able to respond to outbreaks, disease outbreaks when they happen in a community. They also engage in health promotion, which is basically about empowering communities such that they take control of their health. So we teach them how to maintain hygiene and washing, and also practice proper lifestyle. We enact policies that are concerned with protecting populations, policies such as tobacco, smoking. These policies are basically concerned with making sure that bad practices are penalized. So, smoking in public places could be an example of a health policy. Driving with a seat belt, making sure that people are riding motorcycles with helmets on, garbage disposal issues, issues to do with allocation of resources, vaccination, and also issues to do with how healthcare is financed. All those are examples of health policies that are enacted by public health professionals to ensure that the populations are protected. We also conduct research in different areas to generate new evidence for practices that we actually do. Sometimes we are faced with health problems that we don't have knowledge of, and therefore we need to carry out investigations to understand these health problems, where they emanate. So we also look at the potential causes, risk factors of different health problems that happen, and we can do that through epidemiological research studies. And therefore, to be able to carry out the function of protecting and promoting health in populations, one needs to have studied different subjects or different disciplines. And that therefore means that public health as a discipline is a diverse field where one has potential to be playing different roles. So you can emerge out to public health as a specialist in epidemiology. So you become an epidemiologist. This is an epidemiologist is basically concerned with making sure that they design epidemiological studies to be able to, one, understand the health problems in a community related to, and then also relate the health problems to the exposures, identify risk factors, be able to relate exposures to health outcomes, and a lot of different roles that epidemiologists can do. Epidemiologists usually rely on data, and therefore you can say that biostatistics, which is also a core subject in public health, feeds epidemiology, which is also a core subject of public health. So with biostatistics, you're applying statistical methods in health sciences. So therefore, the role of biostatistics in public health is to ensure that we we are able to collect data that is relevant and be able to interpret it and be able to design interventions that can tackle these different health problems that we face. And then the third, you can become a health advocate. A health advocate is one who stands out to say that this is all what ought to be done, depending on the given situation. We have populations which could be marginalized. These actually mean that these populations are not well catered for, and they have poor health outcomes. And therefore, there could be need that advocacy is carried out to promote the investment of health services, investment into health services such that people who are marginalized can be able to have equitable and fair access to healthcare services. So therefore, raising that voice to make sure that marginalized people are heard and that the right actions are taken. This is basically what you call health advocacy, and therefore you become a health advocate. Health educators teach people, or they educate people on how they can live healthy, and how certain diseases are transmitted, and how people can actually protect themselves from different health problems. And then health researchers can work in different institutions, in government, NGOs, and also the private sector. Researchers give us new knowledge, or research actually gives us new knowledge about the prevailing health problems that we could be having. And then lastly, but of course it's not the last, there are many different careers that you can have in public health. That is health administrator. This is basically to mean that health interventions or health organizations need managers and administrators, and they ensure that health organizations actually run efficiently, effectively, and also if they're profit-making organizations, then they should be able to run profitable organizations. So public health as a discipline is characterized by having an approach that emphasizes populations rather than individual patients or individuals, basically. So unlike clinical disciplines where a doctor or a nurse is actually looking at a patient who comes to their hospital or health facility, in public health, the focus is on populations. These populations could be a given county, a given boma, a given state, or even a country, or even cross-cutting different countries. And that becomes basically global health. And then it is multidisciplinary in that for one to have competences in public health, you must have gained knowledge in epidemiology, biostatistics, behavioral sciences, economics, management. So therefore, public health as a discipline has other disciplines that you need to be able to be very competent. The focus of public health is on prevention, because prevention is cost effective and it does not result into wastage of resources. It's better to treat to prevent conditions than to treat them. So we look at the different levels of disease prevention. It relies a lot on evidence. So in your careers, you will continuously be reading and updating your knowledge on the latest research on different interventions. We have interventions that are cost effective. There are interventions that are effective, cost effective, and they're efficient. And there are those that are inefficient and they don't have major impact. So you need to continuously be looking out for the latest evidence on which interventions are actually bringing which results. So it relies a lot on evidence. And then it is collaborative in nature. This actually means that in public health, we work with different sectors, promote health of the population. So there's need to have partnerships and collaborations with different actors, NGOs, government organizations, and also private sector, and also religious organizations. Public health is equity focused. This means that public health is focused on identifying populations that don't have fair access to resources or fair access to health resources, or fair access to healthcare services. So equity as a term is the one that actually explains that people should be treated fairly and in a just way. So the key terms are fairness and justice. Public health also has a global perspective. This is to say that the activities that we carry out have global impact. Yeah, so we have different health problems that we tackle in public health. Majorly, like for example, in developing countries, communicable diseases are the ones which actually pose one of the greatest public health challenges. But of course, we are also having what we call the double burden of diseases, which is basically to say that um, whereas we are having communicable diseases, we still continue to have an increase of non-communicable diseases at the same time. And then mental health challenges, these are often neglected issues, but they are very, very important to be looked at. For example, in South Sudan, we don't have a proper mental health policy to guide the training of mental health professionals, the referral system, the financing of mental health. So this is a very huge burden that we have in the country. And then we move forward to health inequalities. This is to say that we have populations that are having poor health outcomes compared to others. So in public health, we actually need to identify those populations and be able to enact or implement interventions to be able to bring out, to improve the health outcomes of those communities. And then we have injuries that can be attributed to maybe road traffic accident, of course, gun injuries. We also have accidents, suicides. All these contribute a lot in terms of mortality and also expenditure in healthcare. And then the other challenge is also what you can term as bioterrorism. This means that actually countries need to be very, very conscious on potential bio threats that can happen because they have the potential to cause a lot of mortalities. Yes, so we can turn our attention to prevention in public health. We say that one of the key features of public health is prevention. And I did also say that prevention is actually cost effective. It brings out a lot of impact compared to if you wait for individuals to have health problems and then you try to deal with the health problems. It's better to deal with them with the health problems before they start to manifest. So we have 5 levels of disease prevention. We have primordial prevention, primary prevention, secondary prevention, tertiary prevention, and then quaternary prevention. So we are going to look at each of these. Primordial prevention is when you actually realize that we have political, social, and economic factors that contribute to different health outcomes uh, amongst different populations. So if you address these factors, then you are going to be able to contribute to improving population health. So therefore, if you look at these factors could be poverty and then also socioeconomic disparities. If you have poor people in a community, it is likely that they are going to have poor health outcomes. So why not work on addressing poverty such that people have enough money or income to be able to sustain their lives, to be able to buy good food, to be able to live in good neighborhoods, to be able to take themselves to the health facilities and get the optimal health care that you want them to get. And then also issues to do with ensuring that people have access to basic education and also employment opportunities, ensuring that their environment is safe to live in, and also that they actually participate in all interventions that are geared to improving their health. And then the other issue is to address underlying structural factors that can contribute to poor health outcomes. Issues to do with racism, discrimination, and other forms of social injustice can be dealt with. Primary prevention is one which actually focuses on ensuring that diseases don't happen in the first place. So interventions such as vaccination, living a healthy lifestyle, uh, ensuring that the environment is safe, and then regular exercises. These are uh, uh, primary level interventions. Secondary level interventions ensure that diseases are detected at an early stage such that they don't cause a lot of harm to the individuals. So therefore, programs such as cancer screening, detection of hypertension at an early stage actually very important. Tertiary prevention is now when the disease has had an impact on the person, but you want to minimize the impact of that disease on the person such that they have an improved quality of life. So interventions such as rehabilitation, physiotherapy, uh, these are rehabilitative interventions. And therefore we can call them tertiary prevention interventions. Palliative care, ensuring that people who have terminal illnesses are provided with terminal care. Then lastly, we look at quaternary prevention. This is the concept that is related to tertiary prevention because uh, at this stage the person has the disease, but now the focus is on ensuring that this person is not over-treated, over-medicated, and over-diagnosed for a particular condition that they are having. Because these procedures of over-treatment, over-medication can result into other complications and may not really be very effective. So the emphasis should be on looking at other interventions that can actually be equally effective. The concept of new public health is one that is actually new, that addresses public health problems in a holistic way. And the focus is on ensuring that population problems are looked at in a multidisciplinary approach. This is to say that health is influenced by many factors, and therefore, if you want to improve health outcomes, you might need to have a group of different professionals coming together and design an intervention in multidisciplinary way. The focus is also on ensuring that the underlying socioeconomic and environmental factors are addressed such that health problems can be addressed. It also acknowledges the fact that health is not just a mere absence of disease, but it has a lot to do with the state of physical, mental, and social well-being. The concept of social justice in public health is one which actually emphasizes that everyone in the community should have access to health resources or health services in a fair and an equitable manner. Okay, so therefore, I say that public health looks at these aspects such that everyone is having an equal chance to be healthy in a particular population. And therefore, when looking at social justice as a concept in public health, you will look at issues to do with ensuring that all populations are having similar health outcomes. So people who have health outcomes that are because of certain unjust interventions or unjust decisions, they have to be looked at or they have to be prioritized. So addressing issues of social health disparities, which is basically a concept to do with the fact that in a particular population you can have individuals with poor health outcomes in relation to the others. So it is very important to address the structural causes of these disparities or inequalities. Communities have to be empowered such that they can be able to speak for themselves and also participate actively in different interventions of public health. Public health has a lot of challenges. For example, we have just had the pandemic, the COVID-19 pandemic was an emerging disease that caused a lot of devastation. and may not be the last. It is very important that public health professionals actually are on alert to detect potential emerging diseases. And then we also have increasing numbers of non-communicable diseases. People having these diseases increasing. And then we also have health disparities, which we have talked about. We have populations which have limited access to healthcare services because of war, because of poverty, and because of natural calamities. We are having climate change, which has an impact on health. We have diseases that are emerging because of climate issues. And then political stability is very important because political instability can cause destruction of health infrastructure. Um, the emergence of new technologies also poses great threats to public health professionals in relation to privacy and confidentiality issues. So these technologies, however much they are actually very important, and they can be deployed in health, they also come with their own ethical issues. And this could include issues to do with privacy, how much data about a person can you collect, and what are you going to use it for, and what are the chances that this data may not reach into hands of individuals who may infringe on people's privacy and issues to do with confidentiality. And therefore, to address these challenges, it is very vital. It is very, very, very vital to address these public health problems through having very robust disease surveillance and monitoring systems, having or investing a lot in health promotion and education, ensuring that the environment is well protected, and that building health systems that are resilient and efficient, and continuously conducting research to improve health outcomes. It is very important to build partnerships with different actors, also become a voice for those who are voiceless, and also cooperate at different levels. We need to look at the history of public health. The history of public health is very complex. It's actually very important that one realizes that across the ages, people had different views on what actually causes diseases. And as time went on, with acquisition of new knowledge, people's understanding of diseases started to emerge. And some of this knowledge and development that happened is what we may actually look at as the basis of explaining the history of public health. One of those key events is when there was a plague in Athens, the one which we call the Plague of Athens. It is a major event that actually had a lot of impact in public health. The outbreak of cholera in London, also where the physician Dr. John Snow played a very important role in identifying the mortalities associated with cholera, and then being able to map that out and relating the mortalities to contaminated water source. The formation of the U.S. Public Health Service is also a key event in the history of public health. The discovery of microbes such as bacteria in 1862, and then also the discovery of the linkage between health and nutrition. These are key events that played very, very significant roles in the history of public health. Then the formation of WHO, the World Health Organization, in 1948, also very important because it actually oversees the promotion of health and prevention of diseases globally. And then discoveries such as the discovery of the DNA is also played very important role in understanding how inheritance actually affects this disease manifestation and things like that. And then lastly, the issues to do with the HIV pandemic. So generally, public health is very diverse, and it is very important to invest in public health in order to address all these emerging problems and address issues to do with health disparities. Thank you very much.